I'm joined now by Dr Kerrin Begg, a public health specialist at UCT. Good evening, Doc. Now, you're part of a group of concerned doctors who actually raised the red flag last week. And this was because of that super spreader event that happened from one nightclub in Cape Town and spread to any number of kids around 7 schools. Are we actually in a second wave already?
So there are a number of factors that would indicate whether we're in a second wave or not. The first would be significantly daily increased cases. The second would be increased hospitalizations, and the third would be increased deaths. At the moment, it's probably too early to say that we're in a second wave, but certainly we're at high risk of a second wave. We are certainly seeing slightly increased day-on-day cases again. We were up to over 20,000 recently in terms of tests done. So people are testing more, which means that either people are more alert or worried, or there are more contacts, or there are more symptomatic people who are needing testing. In terms of positives, the positive rate per 100 tests is also increasing. So we now back up to around 12% of positive tests. Of tests per positive case. So we're starting to see kind of warning signals. That doesn't mean that we're in a second wave yet, but it certainly does mean that we are concerned.
Do you think it's all about complacency? I mean, we've got this footage that we've been playing of, and it's not just teens, let's be fair, it's not just school kids. People just partying like it's 2019, no masks, lots of hugging, and there's a sense that we're through this awful thing, let's celebrate, summer is here. It is so difficult to deal with that complacency because I think we actually all feel it.
So I think that the big challenge is with COVID fatigue, which is where we're at. People have been living in this heightened level of anxiety and heightened level of stress for quite some time. And at some point, you have to move over into that becoming habit rather than it being a fear-based process. So what we really need to do is convince people that it doesn't mean that they have to forego everything that's fun. It's just about the choices that we make. And so perhaps one of the useful ways of understanding it was something, in fact, that one of the Chinese health authorities released, which was avoid the 3 C's to avoid clusters. And avoiding the 3 C's are avoiding closed spaces without ventilation, avoiding crowded places with lots of people close by, and avoiding close contact settings. Such as close range conversations. And so that confluence of the 3 C's then has a heightened likelihood of cluster infections. So we are going to continue having the odd infection here and there. What we really want to do is avoid those big bushfires getting out of control. So if we have, one infection here and there and we can quickly douse it, so that it doesn't become a bushfire, as Shabir Mahdi explained earlier in the epidemic, or Prof. Abdul Salim Karim. So for those, that's really what we're wanting to do, is keep those tiny little sparks watered down, get those cases that are positive, which we will have for quite some time to come, get them isolated, get their contacts quarantined, and have no further spread. We want that R rate to be low. The challenge with congregating is that we have a quick spread of cluster, and that's really what happened with nightclubs, sports clubs, and other congregating, sleepovers, parties. That's where we really have our challenges.
So do you think it's a good idea that a number of principals are cancelling the matric dances?
Absolutely, and I'm advising schools to. It's an incredibly difficult position to have. So, and it's not just because of the dance itself, which may be well controlled, but it's also about after party. So there's a whole sequence of things that happens in that kind of space, that people have pre-drinks and then they get together and dance, and suddenly, particularly if alcohol is on board, people's natural thinking and reservations starts to go out the window, and they start taking risks. and stop thinking clearly, and suddenly those 3 C's are all part and parcel of what happens, and suddenly we have a cluster. And that's really what we're wanting to avoid.
At the same time, government has just issued a revised list of high-risk countries. So in other words, countries that cannot come here for leisure purposes. The original list was 57. The new list, I think, is 22 countries long. Plus, if you are prepared to come to South Africa for an extended stay and have property here, you can actually get in no problem. First of all, how risky is that? And isn't it a little unfair?
So it's always around trade-offs, dilemmas, tensions. There are never any clear-cut answers. I think that what we're really looking at is avoiding crowded areas and congregation. Unfortunately, flights are relatively high risk in their own right, just because it's lots of people together over a protracted period of time. So in terms of those 3 C's, it pretty much ticks all the boxes. So testing people prior to arrival, going into quarantine for a 10-day period, all of that mitigates the risk. So it's really around mitigating risk, and can those mitigating measures avert a cluster infection? That's really what you're wanting to do. So any of these kinds of celebratory events, what you're really wanting to check is, can you mitigate most of these factors?
This is something that came up, I think, in the USA last week. It's been spoken about a lot. But how close are we to getting a rapid test in South Africa, one that takes less than an hour to process? Because that will surely be the game changer.
So one of the struggles about a rapid test is that at the moment, the rapid tests are predominantly antibody tests. So it's similar to what we do for HIV. Unfortunately, with COVID, with a rapidly infectious disease like COVID, is that an antibody test essentially doesn't tell you that you currently are infectious. It tells you that you at some point in the past had COVID. And so the rapid tests that are currently available in terms of measuring the antibody, which is your reaction to the SARS-CoV-2 virus, are not very helpful for us controlling the epidemic. They are very helpful for telling us prevalence, in other words, what proportion of the population has had COVID. And so we start to get an idea from a public health point of view around where heavy areas are. But they're not very helpful for diagnostics in terms of who is currently infectious and currently has the disease process. That is why we use the PCR test, which detects the antigen so the genetic material of the actual virus right now, so that we know that you are infectious. So that's the real struggle with rapid testing.
Well, thank you very much for that update. Dr. Kerrin Begg, a public health specialist at UCT, agreeing that it is a really good idea, but a very tough choice to make, to cancel matric dances this year.